In today's session, we're going to talk about somatic symptom disorder. Somatic symptom and related disorders are characterized by prominent somatic symptoms associated with distress and impairment, and are more often encountered in primary care and other medical settings than in psychiatric or other mental health settings. A characteristic distinctive of all somatic symptom and related disorders is that the diagnosis is often less about physical complaints and more about the way that they are presented or interpreted. Affective, cognitive, and behavioral components are incorporated into the criteria for somatic symptom disorders, providing a more comprehensive and truer reflection of the clinical picture. This group of disorders overlaps significantly with mental disorders formerly diagnosed under the umbrella of somatoform disorders. But the conceptualization, descriptions, and diagnostic categories are quite a bit different from those. The diagnosis of somatic symptom disorder is characterized by one or more somatic symptoms that are distressing or result in significant disruption of daily life, coupled with excessive thoughts, feelings, or behaviors related to the symptoms or health concerns. Even if any one somatic symptom is not present on a continuous basis, the state of being symptomatic is persistent, typically lasting for more than 6 months. The DSM-5 offers specifiers of with predominant pain for individuals whose somatic symptoms predominantly involve pain, and persistent when there are severe symptoms, marked impairment, and a long duration of more than 6 months. Excessive thoughts, feelings, or behaviors, and health concerns present in the disorder can be manifest by A. disproportionate and persistent thoughts about the seriousness of one's symptoms, and or B. persistently high level of anxiety about health or symptoms, and or C. excessive time and energy devoted to these symptoms and health concerns. Specifiers for current severity are mild, if only one of the manifestations of excessive concern are present, moderate when 2 or more manifestations of excessive concern are fulfilled, or severe if 2 or more manifestations of excessive concern are fulfilled, in addition to multiple somatic complaints or the presence of one very severe somatic symptom. Risk factors for developing somatic symptom disorder include personality traits of negative affectivity and environmental factors such as a few years of formal education, low socioeconomic status, or recent experience of a stressful event. Prevalence is really unknown, but estimated to be around 5 to 7% of the general adult population, with females tending to report more somatic symptoms than do males. The development of the disorder is associated clearly with marked impairment in one's health status. Let's practice with a question for somatic symptom disorder. Stacy, age 42, claims that for 10 months she has lower back pain, gastrointestinal troubles, and a slight discomfort in her forehead. She has been to 3 different physicians, and although she continually says these symptoms exist, the physician claims otherwise. Her symptoms more than likely point to A. acute anxiety disorder, B. somatic symptom disorder, C. generalized anxiety disorder, and D. functional neurological symptom disorder. The correct answer is B. Acute stress disorder is an anxiety disorder that can develop in individuals who have been exposed to a traumatic event in which there is a threat or experience of death, serious injury, or risk to one's physical integrity, or to the individual and or others, which makes answer A incorrect. Individuals diagnosed with a generalized anxiety disorder demonstrate excessive worry and anxiety surrounding a variety of topics, for example, work, school, or one's health, for at least 6 months, making answer C false. Conversion disorder, also known as functional neurological symptom disorder, occurs when an individual develops symptoms affecting voluntary motor or sensory functions. Although the impairments in functioning are suggestive of a neurological condition, they are etiologically related to psychological rather than medical factors, making answer D false.